Good morning, good afternoon, good evening, everyone. You're welcome to another episode of Public Health in Real Life series. Today, the topic is COVID-19 and its impact on the African continent. And we have with us distinguished Professor of Public Health, Professor Tanimola Akande, who will be speaking with us about the impact of the pandemic on the continent, lessons that have been learned, the first wave, the second wave, and then recommend next steps on how we can achieve equity in pandemic preparedness and response. Over to you, Ashwin.
Hello, everyone. This is Ashwin Kadambi. I work as a senior officer within International Medical Corps. We are excited to bring public health and global health leaders who work in the front lines of public health response, administration, and management to share their experiences and shed light on the current topics in public health and also neglected topics that are not usually covered in the public health and global health realms. Today we welcome Dr. Tanimola Akande, and it's a privilege to be able to talk to you today. Dr. Akande, welcome to the program.
Thank you very much. Thanks for having me.
So a little bit more about Professor Akande. Professor Akande is a professor of public health at the University of Ilorin Teaching Hospital, Nigeria. And he's also a consultant public health physician at the same university. He's a specialist in health management. He has been at various institutions at different points in time. The Department of Epidemiology and Community Health in University of Ilorin. He was actually a lecturer of mine way back in medical school. He's currently a member of the Expert Review Committee on Poliomyelitis Eradication Initiative and routine immunization in Nigeria. He is a member of the Scientific Advisory Board of the Vaccine Impact Modeling Consortium, which is the VIMC, and is a member of the Governing Council of Brigham University in Cairo. He's a member of Board of Trustee of Farm Access Foundation, an organization that is looking to build health systems, specifically in resource-limited settings. And he's an accomplished and seasoned academic with over 880 publications under his belt. Welcome, Professor Akande. The World Health Organization, the regional office, AFRO, has reported that COVID-19 deaths and cases are surging in Africa as new and more contagious variants are being seen by the day. Over 175,000 new COVID cases and more than 6,200 deaths have been reported in the last week. And it said that infections have risen by 50% between December 29th, 2020 and 25th of January, 2021, which was just last week. Can you elaborate more on the second wave of the pandemic on the continent so far?
Well, again, thanks for having me. Maybe I should just start from the fact of the current situation, and even before we get to the second wave, that, well, the world got into COVID December 2019, the first case reported in China, and the first case reported in Africa, in Egypt, 14th of February, and declared a pandemic by 11th of March in 2020 by WHO. And as of today, globally, there are over around 2 million cases that have been reported, with over 2.2 million deaths. In Africa, more than 3.5 million cases have been reported to date, and almost 90,000 deaths. So that's where we stand when in terms of the magnitude of this problem. And we're into the second wave, certainly, because we had a reduced number of cases following the first wave with the various interventions put in place. And as from November 2020, cases began to surge again. And so we're into the second wave. This has affected Africa, and even much more so of recent. Previously, the case fatality rate, that is the death rate, in Africa was less than the global average of 2.2%. But currently, Africa stands at about 2.5%, which is higher than the global average of case fatality rates. So we are having a big problem with us, the COVID pandemic, striking Africa like it's striking other continents in the world.
Thank you so much, sir, on that elaboration. It's interesting that you mentioned this second wave actually has an equitable, if not worse, case fatality rate than, or it's equitable with other regions in the world. It's, however, interesting that in the first wave, a lot of global health experts were stumped by the fact that they had assumed COVID was going to devastate the continent, but it didn't. The rate of COVID-19 deaths in Africa was said to be combined less than in France. I was reported in a recent New York Times article, and they listed several causes, either the youthful population, a lack of accurate reporting, data collection, and deaths. A recent New York Times article actually titled "A Continent Where the Deaths Are Not Counted" elaborated on that piece. Could you shed some more light on that, please?
Well, that is true, that in the first wave, from the data coming from Africa, it suggests that the burden is not much as compared to other continents. And like you mentioned, various reasons have been adduced for it. One of it is data, correctness of data, and then the capacity with testing. Of course, if you don't look for it, you might not find it. So probably that will explain that. Beyond that, other scientific, the way it affects the pandemic affects the whole world, that it affects the older age.
You're slightly cutting, Dr. Tanimola Akande. I think we are losing Dr. Akande. But it's a nice point you bring up, Maimuna, regarding how the New York Times article talks about how the continent, where there's a lot of challenges when you talk about counting the number of deaths. You see a lot of countries that don't have formal ways of tracking the number of people who are dead, and they are mostly underreported from what we know. And we also see that there's a lot of unless there is a need for inheritance of property, or they need the death certificate for other purposes that are related to finance, the public don't go and visit the birth and death registry. So those are some of the challenges that we definitely see. So I think we have lost Dr. Akande. Let me just check if he's back.
Yeah, and whilst we wait for him to rejoin, it's interesting you mentioned that part about data collection, because Professor Akande actually has a study that he published in 2015, where he talked about birth and death registrations using Nigeria and some other sub-Saharan African countries as proxies.
Sure.
And it would be interesting to just get more of his insight into the capacity for testing, like he mentioned, for data collection and assessments.
Yes,
Yeah, so
Dr.
sorry about
Akande is
the
back.
network. I hope you can hear me now.
Yes,
Yep.
welcome back, Prof.
I'm so sorry about that.
No worries.
Yeah. So we're talking about the fact that what are the factors responsible for this in Africa? Like I said earlier, the disease itself affects the elderly more, and then those with comorbidities. And if you look at the population structure or the demography in Africa, you will find that it's more of the youthful population, with only, say, about some places 3% that are above 65 years. Whereas in some other countries, as much as 20% of them are more than 20 years, more than 65 years old. And so naturally, since it affects the elderly people more, then you expect that the burden will be more in those countries. As well, these comorbidities too. And okay, let me say Africa has a young population. About 25% of Africans are very young people. And then the comorbidities are not probably as much as we have in the developed countries. And there is also the belief that climate has a factor to play in this. Some studies have been done. I think University of Maryland in US did a study to show that there's correlation between temperature, humidity, latitude, and then the spread of COVID-19. So we might be having this as an opportunity in Africa. That's why it's reducing the spread of it. Also, we have the fact that it sees beliefs that some people are already exposed to some other forms of the coronavirus, which may not be the COVID-19. And so maybe some level of immunity already in people, protecting them against this. So that might explain somehow, but likely I think is the lack of testing initially, or the low testing initially, will probably be responsible for these differences.
Right. So that's a really good observation, Dr. Akande. In terms of the world's view on things, especially when it comes to Africa, because the numbers are already low, even leaders like Bill Gates have asserted that the continent was not much affected, or people say that Africa has been spared this time. So what would be your response to those kinds of false claims?
Well, Africa is not really spared, as so to say, for the reasons I gave earlier. That those factors probably explain the low infection rate in Africa. And then the fact that we are not testing enough probably will also explain that. When this thing started, you figure out that with the weaker system in Africa, then we are probably doomed. But that has not come to real play as now. And that's why people think that probably Africa has been spared. No, it's not really spared. The viruses are very much here as well, but probably for some other reasons that I mentioned earlier, they are not coming out in terms of data.
Right. And what are some measures that African governments can take to make sure that they ramp up the amount of testing that they do, or even some regulatory steps they can take to curb the pandemic within their own, or curb the epidemic within their own nations? Maybe like installing more hand washing instruction, in which case they must have access to water. They can install a international travel ban. In that case, the trade can be affected. There are associated challenges with each and every measure that we can think. But what are some functional, workable, and successful steps that governments can take to better capture the coronavirus burden, morbidity burden?
Yeah, luckily, globally, there are protocols that have been developed to address the COVID-19 pandemic, particularly developed by the World Health Organization. And the African region is not left behind in this. And various countries too have their WHO offices that have been very much involved in the control of the pandemic.
Yeah.
We also have the African CDC that is very much involved in it.
Yes.
And then they have been providing technical support and guidance to countries on how to go about some of these measures. These are very familiar measures that we know.
Right.
In the beginning, you have borders closed,
lockdowns, yeah.
But unfortunately, this had serious effect on the economy of most of these African countries. Even probably the effect is much more felt in Africa than the other continents in the world.
Right.
And so it's very difficult for government to continually use these measures
Yeah.
So some other measures must be deployed to control the pandemic. And the non-pharmaceutical interventions come really to mind now. And that is creating more awareness and providing the environment where these measures can be put in place. There are countries that have come out with policies, some even laws, that ban the lack of use of face masks in the public places. We need to continue this and ensure that they are enforced. It's not enough to have policies rolled out or laws rolled out, but if they're not enforced, then we'll be creating more challenges. Now we have policies that address gatherings, maximum number of people that should be there, and then the social distancing, use of face masks, like I mentioned, and then washing of hands with water and soap. But like you mentioned, we don't have the luxury of water and soap like we have in the developed world. And so government need to step up on this to make this available to people so that they can readily practice what we want them to do. And also, testing must be stepped up seriously. But I must say we've done, most African countries have tried very well in this respect. The number of laboratories that are coming up with capacity to test for COVID-19 are quite a number now. If I want to use Nigeria for an example, at the beginning it was just about 4 labs that were able to test for COVID-19, but now we have over 100 labs that are able to do this. And so we have to step this up and also make reagents available, readily available because those that are being tested in public facilities are tested free, and that's at a cost. So the money must be, the fund must be made available such that people can be readily tested. And if we ramp up testing, we are likely to see greater burden of it and then do more in terms of interventions. Also, the issue of vaccine comes into mind now. The government must step up fast and key into vaccine availability in the various countries. You will recollect that the WHO Director General a few weeks ago made a quote that over 30-something million people in the high-income countries have received the vaccines.
Correct.
And only 35, not 35 million, not 35,000, but just have received in the low-income countries. And so government must step up to see how they can access vaccines.
Yeah, in fact, that was our next question because, as you said, while if you look at the complete vaccine manufacturing, the world population, only 16% of the world population are constituted by high-income population or high-income populations represented by high-income countries. But 60% of the vaccines that have been manufactured have gone to these countries. So in terms of vaccines itself, vaccines are procured and distributed in several countries within Africa, as we know. But what are some steps that African countries can take to ensure, at least in the near future, there is adequate vaccination and, getting towards curbing the spread in that way?
You are very right. There's a lot of inequity when it comes to some of these control measures for the pandemic, just like we have inequity in testing, we have inequity with vaccine, inequity with reagents and so on. Particularly more so with vaccines. Like you said, most of the vaccines available now are already been procured by the high-income countries. So the low-income countries and the middle-income countries are battling, trying to secure vaccines, more so because they don't have the phone. But it's good to note that there's the COVAX facility available for this. COVAX is led by WHO and by also Gavi, as well as the Coalition of Epidemic Preparedness Innovations. And they've come together to make it easier for low-income countries to access these vaccines. And they've listed out countries that are eligible to access the COVAX vaccine. And amongst them is the 46 countries in Africa that are eligible for it. And so the countries should key into this and get supplied with the vaccines. And African Union, I also know, has also stepped up trying to get some vaccines that can be distributed to the various countries. They are trying to secure 270 million doses of vaccine to be delivered from various countries as from April. So with this, I hope the countries will readily have the vaccines available maybe as from next month, so that much more of their people can be vaccinated. The more they will cover with vaccination, the better for all these countries in the control of the pandemic. Thank you.
Thank you, Prof. That is really insightful, where you mentioned how many million doses have been given in certain countries and only 35 in Africa. And the graphic we have on the screen now just shows that there's really either no data or like less than 0 to 0.5% vaccination rate per 100,000 population on the continent, which is a stark reality. Interestingly, though, recently, Bill Gates, he issued a statement where he was advising the Nigerian government, and that drew criticism, not to invest in vaccines, but to invest in the underfunded health systems. So what would be your take on that piece?
Well, I think Bill Gates also is quite familiar with the health system in Nigeria and has been supportive to quite a number of public health initiatives in Nigeria. For his own personal point of view, he has made that kind of a recommendation. For me, I don't think it's entirely wrong. It's not saying you should not buy, it's how you prioritize it. How many million doses will you want to buy on your own as compared to with improving your health system? Because if your health system is not good enough, where a situation where you have cases and they are dying, or because you don't have ventilators, you don't have the simple PPEs, then the vaccine is not enough in itself to control the pandemic. And we are battling with not just COVID-19. Already, Africa and Nigeria particularly is battling with a lot of disease burdens, both communicable and non-communicable diseases. What maybe is trying to infer is that if you strengthen your health system, you will have what it takes maybe to address some of these health challenges, which include COVID-19. But I don't think he's saying you should not buy the vaccines at all. But how many millions should you buy? How many should you be supported with, kind of? But for Nigeria to, like somebody mentioned, the budget for the whole health sector in Nigeria, if you are using 10 times of that to buy vaccines, and it means a lot will be left undone. So I think it should be addressing both ways. Procure vaccines, at the same time, help improve your health system.
That's a great insight and perspective. Thank you for sharing that. You had mentioned earlier when we asked about vaccines, testing capacity, and now we've mentioned health systems. We know the Africa CDC set up like regional genomic sequencing labs just to boost accuracy of testing capacity. We do know that as it comes to vaccines, in order to drive costs down of whether it's vaccines, diagnostics, therapeutics, you have to look into local production and manufacturing. So do you know of any organizations that are into research, looking into how to produce all of this equipment and supplies that would help drive costs?
Well, I know that there are certain researches going on in Africa, and even particularly in Nigeria. We have some labs that have the capacity to do some of this genetic sequencing, but they're not quite a number. Maybe just one or two that have the capacity to do that. That maybe if we improve on that, the human resource to do that, I don't think we are really deficient in Africa. It's about making the facility or the equipment available to be able to do that. So if, in terms of vaccine production in Africa, we are still a long, long, long way to go. My view is that you can't suddenly wake up and you want to produce vaccines, it takes a lot of capacity building over time in terms of infrastructure and some other things to get that done. But I know some countries that are already there, getting close to it. And then collaboration with some private sector bodies will, to me, go a long way. I don't think government on its own should go headlong on this, bearing in mind that they have limited resources. But if they partner with good, reputable organizations like Pfizer, May and Baker, and so on, they might be able to set up such industries that can produce vaccines locally. But the human resource to do that, I don't think is a major challenge, but the facility, the infrastructure is not very much in place. And it's not something you just put up in days.
Yeah, so that's a really good point, Dr. Akande. This was actually my next question, because related to HR, even though we have these partnerships with Pfizer and other countries and companies, and we bring in the vaccines, in terms of the vaccinators, we have low human resources to actually administer the vaccine into the arms of people. I do, of course, we also wanted to talk about the cultural aspects when it comes to vaccinating people and vaccine acceptance. But in terms of more of the vaccinator availability in the continent, what are the steps we can take now to ensure that there's enough number of vaccinators once the vaccine becomes available, and the level of training needed to be provided to them so that they are prepared to provide the vaccines once it becomes available?
Well, generally, we know that we have shortage of health human resource in Africa, more so with the drain to some other parts of the world. But when it comes to the level of who can provide vaccination, they're talking about say nurses, community health extension workers, and so on. We are not terribly short of such people. It just requires the appropriate training to get that done. More so that we have, over the years, been part of various campaigns. The polio eradication campaigns, which have deployed hundreds of thousands of health workers. The measles campaigns, which have deployed a lot of hundreds of, all across Africa. So I want to believe that it's a matter of retraining them to be able to do that for the COVID-19.
Got it. Thank you, Dr. Akande. And in terms of the vaccines availability as well, in addition to partnerships, several countries have started donating to Africa and other low and middle income countries, where while they are already vaccinating their own populations. And then you have some other countries like the United States and few other countries whose national policy is to actually vaccinate majority of their population first and then go to Africa. So would you and science support parallel vaccination of their own population and other countries' population, or vaccinate the high income countries first, then go to the low and middle income countries?
Well, that is the issue of equity. It's just that the high income countries have the resources, particularly financial resources, to get that done. But we know that the issue of COVID-19 has no borders. If you help yourself there, some other people will cross and then get you infected. So it's better to think globally rather than think just nationally as it is for some of the countries today. There must be a global response to this if you want to get this off as quick as possible. And so I want to encourage that these countries have been doing that in the past with various other diseases that control programs. They should continue. I think there's also pressure from their own countries to ensure that there are as many as possible are are covered and they have the appropriate herd immunity. But you cannot neglect the low-income countries like mostly in Africa. And then if you do that, then the issue of equity is no longer there. So I think it is the right thing to do is, well, they should do that their own, but they should also think about other countries that are deprived of these vaccines. It's even more so that if you are mopping up, even when the low-income countries have some fund, like through the African Union, if the developed countries, like that is the high-income countries, mop up all the vaccines, then where will the vaccine be to buy? So it's good that we think about other countries and give them the benefit too, knowing that they're human beings, just like any other.
Yeah, you do raise an interesting perspective, Prof. And there was an article recently where they talked about that even if it's for selfish reasons or self-serving reasons, high-income countries need to invest in ensuring that poorer countries, quote and unquote, actually have access to vaccines, because unless everyone is safe, no one is safe. And you had mentioned COVAX earlier. I know COVAX is working towards vaccine equity, and they have a target of securing 2 billion doses of vaccines. But it turns out that even they are struggling to get those vaccines. And recently it was in the news, I think it was as recent as yesterday or 2 days ago, with the European Union and the current Brexit and how they want to route vaccines. So it definitely brings to light a lot of issues on health equity, like you mentioned. And I think in this point, it's really seeing how we can take that equity-based approach to pandemic preparedness and response. Along those lines, you had mentioned earlier that Africa has the capacity for some of those things like massive immunization campaigns, health workers dealing with infectious diseases. Would you mention some countries or bright spots, or even if it's diseases where we've really excelled in being able to curb the spread of?
Well, although we are coming a little late to it, the polio eradication is one major achievement that Africa had last year. That the whole of Africa is polio-free. But one that comes readily to mind is the Ebola. The Ebola control, we stunned the whole world. We never knew that we have this much of an innate capacity to be able to control the disease, particularly so in Nigeria. And before it could spread rapidly, it was put under control. So much so that even some developed countries had to be learning how we went about it from us. So we have some experience when it comes to some of these infectious diseases, which probably the high-income countries are taken as a long forgotten thing.
Oh, that's really great. Since you sit on many international scientific committees, what steps are being taken by African leaders or people working on the front lines in Africa to take some of those, to disseminate some of those lessons learned and successes to the global world?
Well, there are a lot of fora in the global community for disseminating all these achievements, various meetings at various levels of WHO, Gavi, UNICEF, and so on. All these are areas where there are a lot of collaboration, and then information is shared in both countries. And all along, it has always been collaboration or partnership. All this that we're saying about polio eradication and so on, it's not that we don't have people from the high-income countries coming in to also bring some support. So in that way, information is also shared. I know Africa CDC too makes a lot of publications that are shared with the CDC, and then the rest of other sectors, active players in the health sector. So the information is readily known, so to say. And then we have a number that are also published in various journals that are well known.
Dr. Akande, can you discuss a little bit about how retirees and older adults are affected in the context of Sub-Saharan Africa? Because in high income countries, older adults are usually in nursing homes, and the number of cases in nursing homes are skyrocketed globally. And this has also affected people in other ways. For example, in India and other continents where they have access to people who help them on a daily basis to do little chores in the home, like cleaning the dishes, mopping the floor, and you have this kind of a maid service. But the moment the pandemic hit these countries, older adults were left without any assistance. And then they had to kind of do their own cleaning and maintenance of the home and all that. And so old people have been affected in different ways in different countries. But could you shed a light on how, in the context of African older adult population, and how they have been affected?
Yeah, like you have correctly mentioned, the fact that in Africa and some other developing countries, we have this communal way of taking care of the old ones, unlike the developed countries that are very much used to the homes for the elderly. And when you congregate the elderly together, if just one of them will have the virus, then it's like a wildfire. To clear out virtually all of them. And so we don't have that kind of environment so much so in Africa. And so is there very few of the elderly are probably then affected. So they are retired, but they are surrounded by very young people. In fact, most of them are not even surrounded by people of middle age. They are surrounded by the very young ones who probably will not are not even mainly affected now, except for the second wave, which has shown some variance to what we used to know. But lately, we don't have homes where it will be easy for to spread it like wildfire in Africa and other developing countries. So it's a plus that our culture and our communal way of taking care of the elderly is working for our good.
Yeah, but when people congregate, isn't that also increasing the number of, accelerating the spread in the community as well? But that's the real challenge. In any country, that's been the real challenge with taking care of older adults.
Yeah, you are right. When it comes to congregating, particularly social gatherings, very much so in Africa, even than the, developing world than the developed world, is very much so.
Yeah.
But luckily, governments have been trying hard to pass on the message that the elderly should ensure that they don't get involved in such gatherings. And so it's working to a large extent.
Awesome. Coming back to the response to the pandemic, what do you think is the role of international NGOs that are existing in Africa? Because the belief is that the MOH in each and every country would be leading the vaccination effort in each and every country. But where will the international NGO stand, and what will be their, or what should be their role in terms of the response?
Yeah, that's everywhere in the world. Countries should take ownership of whatever interventions they are putting in place. But ownership does not mean you do it all alone. And so the international partners very big roles to play, particularly in providing technical support, technical guidance, help in coming up with policies, and then help with resources too. They help to draw resources from other countries that have the fund. Like most of these partners, for example, draw a lot of funds from the Bill Gates and Melinda Gates Foundation. They draw a lot of funds from other areas. So, like Gavi is so much supportive to various infectious control programs in Africa. And so much funding is coming from the developed world into this. So these partners are helping a lot in this direction. We have also talked about COVAX. That's largely not an African thing, It's about help coming from elsewhere to support what has been done locally. So there are various other groups, UNICEF and so on, that have great roles to play, either in training. They can also be useful in providing training to the human resource in the countries.
Thank you very much for that insight, Prof. We do have one question that is just coming now, and it's an interesting question. Part of that notion that the African continent was spared, there was one of the factors or one of the theories that was proposed was genetics, that maybe there's something about the African gene that is sparing from either developing serious complications due to COVID or the spread of the illness, things like BCG vaccine. But converse, people of African descent or Blacks and ethnic minorities in the UK, in the US, were one of the most affected by the vaccine. So it kind of like put that theory, question that theory. What's your professional take on that?
Well, I think for this, the COVID-19 is novel. A lot of research needs to go into it to be able to prove some of these things. But like you said, it's both ways now. The deaths are more in African population, African descent in US, and they have the genes of being Africans. So I think it's more with other factors than really the genetic predisposition to it. And maybe I don't think we've mentioned that. Also, the fact that people not deaths are in that might look so, but it's not entirely very correct. But data suggests that we are not reporting because the health information system is low when compared with developed countries. Very few countries report deaths and the causes of death. In fact, only 4 countries in Africa meet up with the international standard of reporting deaths. And so, and a study I did some time ago on death registration in Nigeria, in the Middle Belt. In the study, we found that only 11.8% of deaths were registered in that study. We are even more recent studies have also suggested that it's worse. So it's about some of these deaths are not known, and so it's difficult now to attribute the cause of the death because they're not even reported in the first place.
Well, that's really eye-opening. And interestingly, you mentioned your survey. We had brought it up earlier when we had asked you the question about data collection and the New York Times article. We talk about data-driven decision-making in global health and in health, and accurate collection of data and interpretation of the same is really important. So what would you say will be steps to ensuring that we overcome those challenges of increasing our capacity to collect data, collecting accurate data that then drive decision-making?
Well, I don't think there's any country that is not desirous of getting to this level, but the speed to which you get to that level is so different. And then, well, of course, we have this unfortunate situation too that because over the decades and years, accurate data is not available. Leaders are used to guesstimates, and then they make decisions and policies not based on accurate data. But I think over time we are improving, but not at the speed that we want. IT should make this better, but unfortunately in Africa too, IT is a major challenge. I won't be surprised that if this interview is cut off now because the network will not be good enough. So the IT is a big challenge. Yeah? You don't have good power supply to drive it. The infrastructure too there is not there. But I think on a broad note, particularly as far as Nigeria is concerned, I know we are moving forward. The speed can be improved on, and then the accuracy, particularly in terms of how detailed we have of this data and what proportion of the facilities or population are covered with the data that we have. We know we are still far from it. And I think all countries in Africa should work towards having good data, build their information system well, such that we can have well-informed decisions.
Thank you, Prof. And I think piggybacking off of what you said about just building capacity and accuracy of data, one of the things we talk about is that health is a fundamental human right, but then at the same time, healthcare has to be funded. So some people talk about viewing healthcare as a business. What is your take on, and they usually advocate for developing and expanding on public-private partnerships model to build, or at least build healthcare capacity, improve quality of healthcare. What's your own take on that notion?
Well, there are various ways in financing healthcare, various options. You can put all options to play to see the level of effectiveness and efficiency of the various options. But when you come to talk about Africa, the resources, particularly financial resources, are not very much there. And therefore, the need to have the public-private partnership. I've seen very much where it works. On the board of Farm Access Foundation, Nigeria. And in Delta State of Nigeria, this is working very well. Health facilities that are primary facilities that are centers that have been abandoned over the years were ceded to private entrepreneurs to run as a public-private partnership, and now they are a lot better. So I think it's we have to deploy all. We can't. Government also cannot fold its arms and say, "I will not fund it." You should deploy as much resources to the health sector. Then add on to it the public-private partnership.
Thank you, sir. We have two audience questions here. I'll take the first one from Dr. Kabir Durowade, who I know you know very well. It's actually not a question, it's a comment. He says that negative attitude to protective measures is also fueling the cycle of spread on the continent. Can you elaborate on that piece, please?
It's good that you brought this up. When the COVID-19 thing started, even up till now, there are still people who don't believe there's COVID-19. Some believe it's a hoax, that is just government way of trying to manipulate people, make money, and so on. And unfortunately, we even have some leaders who still are talking mess, and very unfortunate indeed. Even some who you would think should be better informed are also talking in that respect. And so if you have it that way, it is now going to be very difficult for people to adhere to some of these IPCs. That is the NPC, the non-pharmaceutical interventions. If you don't believe it exists, then why would you want to put on a mask? Why would you want to wash your hand? All over the place, visit people or know that. So it is even worse, misconceptions and the conspiracy theories that are ongoing, that are all over the social media. And it's unfortunate that in Africa, we tend to believe this even more than the real truth. That's very unfortunate. And so even when the vaccine get into Nigeria today, we need a lot of work to do to convince people, because there's the potential vaccine hesitancy. Hesitation to take vaccine is very much there in Africa, to know that this is real and that it takes the appropriate measures, and people have their own roles to play. It's not all about government. Every individual has his own role to play, and that is why the question he asks is important. If you don't carry everybody along, then it will be very difficult for us to control this pandemic.
Thank you for that exposition, sir. The next question we have is from one of our audience from the UK, Mrs. Aishat Adebusui. She says, sir, what do you think is the most important thing for African decision makers and community leaders to do during this pandemic?
One, the African leaders largely, almost well, it's not 100% yet, almost 100% know that the COVID-19 pandemic is real. They have their friends, relations that are already victims of this. And so, to put in every measure to control this pandemic should be there. And in terms of supporting their ministries of health at all levels to make sure that resources are available for them. Imagine that you are in a country where this is a big problem. You want to work as a doctor. You don't have the PPEs, that's the personal protective. You won't be encouraged to do that. So now that we know that the international partners are there for us to support in this respect. So if the strong show the strong will, provide the enabling environment for all things to work out well, then it will be well controlled.
And also, Dr. Akande, this Africa also, when people think about Africa, they think only about maybe the sub-Saharan Africa, and but Africa is also a mixture of multicultural and multi-generational and multi-economically. Um, uh, there's all kinds of communities represented who come from different income levels. So the burden of non-communicable disease is also widely seen as increasing globally. What is in the context of Africa? How do you see that? And what is is it growing, or is it the status quo, or how are people affected who are afflicted by non-communicable diseases in this pandemic?
Yeah, in the past, in Africa and particularly Africa, we thought our major problem is just the incommunicable diseases. But now we know that we are having the double jeopardy of battling with the double burden of communicable as well as non-communicable diseases. The non-communicable diseases, hypertension, diabetes, respiratory diseases, they are on the increase. Cancers, they are on the increase. We have adopted the Western lifestyle in most things, and therefore these things are very much with us. And so it's now getting even more difficult with the resources available to be able to address all. Now, the COVID-19, for example, has come into a very weak and fragile health system. It is further making it weaker. Although there are ways it's strengthening, for example, the availability of various labs now is strengthening it. But we know that the resources that are available are so limited, and now we have to deploy so much to COVID, deploy so much to other non-COVID communicable diseases, and now also to address the issue of the increasing non-communicable diseases. We have a lot of stress in Africa, a lot of risk factors to all these non-communicable diseases, unlike before.
Many factors are affected when it comes to a pandemic. It's just not only people, the burden of coronavirus cases. So thank you for that, Dr. Akande. We do have one more question from our online audience. The question is about as the Pfizer vaccine is required to be stored at a temperature of -70 degrees Celsius, how do you think this will work in low-income countries? And are there other options?
Well, we of course know that the low-income countries don't have the capacity to store these vaccines as much as will be desired. You probably will have such facilities in the country capital and maybe a few regional capitals and so on. That is certainly not enough for wide coverage with COVID vaccine. If that is the only vaccine that is in the market and available, then you can understand that you don't have a choice. But in this, we are having choice because there are some other vaccines that can be stored at temperatures that we are already familiar with in Africa. And so I would want to think that while you don't totally say you won't take the Pfizer vaccine, you want to use that probably in the very urban places where there are facilities that can provide storage for it. There's no point getting such vaccines and then you don't have the cold chain to maintain it, because at the end of the day, you'll be injecting people with a non-potent vaccine. So it's important that we ensure that we get the one that will show, but at the end of the day, when it will reach the recipient, it will remain potent.
That's actually a great point you mentioned, and I think that is already addressing the next question from again Dr. Kabir Durowade from Nigeria, and he specifically asked, how prepared is Nigeria to handle the COVID-19 vaccines given the very stringent cold chain requirement?
What the first thing to say is that we are not starting from ground zero. The experience with the various vaccination campaigns that I mentioned earlier, and with the capacity built over the years and the infrastructure in place in terms of cold chain equipment, is massive. But for COVID-19, what you need is a lot more, because you cannot even use these ones only for COVID vaccine. You have to still deal with the prevailing diseases that you are also trying to control. So as you store these older vaccines, you want to store the new ones too. So for me, and from my experience going around most parts of Nigeria and some parts of Africa, I know we still have a very long way to go in terms of adequate capacity to keep these vaccines. But we know we have partners who are really there to support in this respect. For example, Pfizer is ready to make some package where their own vaccines can be well kept and then still potent, but that cannot go all across our countries and the various suburbs in the country. So you can use that for those urban places, few cities where that facility can be, because how will you have that facility cut across the whole country or the whole continent? It's not feasible. And so I want to think that we are not there yet. If we have funding, we can use that to scale up our infrastructure in terms of the cold chain equipment as well. So for me, we are not starting from the ground zero. We still have a lot on ground to use. But even that, there's a lot more that is required.
Sure. And Dr. Akande, can you finally maybe explain about the vaccine hesitation that seen, especially in the context of COVID-19 vaccines?
Well, vaccine hesitancy is very, very, very real. As a person, I've had to deal with so much of it. Questions from people are so skeptical. Even medical doctors and well-enlightened health personnel are still not too sure that they want to take this. And it has to do with a lot of misconceptions about the vaccine. The issue of whether there are microchips there, whether it affects some DNA, and then how come it is so fast in production. All these are myths and misconceptions. And there are and there are the truth is well laid out there. And so we can't be tired really of educating people about this, that this vaccine will not harm. The side effects are, like I keep telling people, there's no drug in the world that does not have a side effect. No drug in the world. To what level is that side effect? Now, globally, more than 60 million people have received the dose of COVID vaccine. What is the level of reported side effects? So low. And so it's the few ones that have been reported that are so escalated on social media to make people already who will not want to take it. And then there is the religious inclination too. People thinking that it does not go well with their religion, and it means the end of the world is coming so close because of microchips and so on. Well, government and other stakeholders have a big role to play in this respect to to get people to know the real fact about the vaccines.
Sure. And also, Dr. Akande, in the United States, we had our president, vice president take the COVID-19 vaccine on live television. Like that, what is the role of leaders? Of course, not only political leaders, but community leaders in Africa who are not only leaders, but they are also popular leaders, like maybe Chimamanda or Dr. Ellen Johnson or these leaders who are known wide across the African continent. What are their roles in ensuring that there's in curbing the vaccine hesitancy or bringing proper awareness to the public?
Now, I think they must be involved. They must be mobilized to get involved in this, in driving the message across. People believe so much in these people. All those names you mentioned, leaders, and then particularly religious leaders. If you mobilize them, for example, I was so glad that I think it's yesterday I was watching the news. A very big religious and traditional ruler in Nigeria, the Sultan of Sokoto, and lending his voice to the fact that the vaccine is safe. So we need many more to do that, and the agencies responsible to mobilize them to be able to do that. And already in Nigeria, for example, we understand that the governors are ready to take their vaccines when it comes, and then they will take it live. Everybody will see it. And so they will know that their governor is not dropping dead after taking the vaccination. That is a good way to go. And then, not that this thing should be taken secretly. The first presidential candidate in Nigeria took his own, I think in Dubai or whatever, wherever, and he made that available to people. And so people who are his followers will now see that this man, after taking it, didn't die, and he didn't report any serious side effects. So they will be encouraged to take that. So we need a lot of this to happen.
Yeah, that's a great point, sir. And there was a previous audience question which addressed this. That's the use of social media to spread misinformation and disinformation, but then at the same time, it should be used as a tool to spread accurate information. And like you said that all these global influencers or regional influencers should use their social media platforms to raise awareness, reducing vaccine hesitancy. And I think even just technical experts like you also come in to talk about the process of developing the vaccine, because that's one of the things that is rapidly spreading on social media. They talk about the fact that it's mRNA vaccine, it's a new technology, it was developed in record time. So what are they trying to hide? So having technical experts like you on this platform and on other platforms really talk about how safe that process is helpful. So I think along those lines, what is your take on the fact that it's an mRNA vaccine and it was produced in record time?
Yeah, you see, I've been on social media in one form or the other on this, and a documentary showing my readiness to take the vaccine as soon as it's in Nigeria. And many more people should do that. And surprisingly, the kind of responses I got was, I was so surprised that, oh, because you are the one that said this, then I will take it. So they believe very strongly in some people. So the more we do that, the better, because these misinformations are spreading fast. We should also try to be fast in disseminating such information using the various influencers at all levels, not just continental influencers, national influencers. Look at the lower levels too, and use them too to spread the message all across. I'm just wishing that much more than just the Sultan, many more emirs and obas will be used, obis will be used to do this, and even religious leaders who people believe so much in will be used to on the social media to spread the good news about the vaccine. That is coming short. I keep telling people. In those days, if somebody dies, it will take about 2 days for somebody to take vehicle from one place to go and report at their hometown that this person has died. Now, it takes you less than a minute to use phone to do the same thing. So it's technology. The same thing is technology that is driving the fast the fact that the vaccine came fast. And I always say, imagine that it has to take the length of time of previous vaccines take, say 5 years. How many people will be left? So I think we are happy that that technology is there, and it's been developed over decades. It's not just new, but it's coming into human vaccination for the first time. So it's good news.
Yeah, that's so true, Prof. And I like your analogy of how we spread information many decades ago, reporting deaths versus now. There is an audience question from Kamal Alabi. I believe you had answered it earlier when we asked about Bill Gates information, but maybe it might be helpful to shed a little bit more light for anyone who joined in late. It says there is this widely circulated statement made by Bill Gates. He uses the word misadvising the government against prioritizing COVID vaccines, and he wanted to know what your thoughts are.
Well, I think, like you said, I addressed this earlier, but there are shades of the reporting of what Brigadier really said. There's a shade that I read, which I believe in, that what he's saying is that it's not that you should not buy, the government should not buy COVID vaccine at all. How much of it should you buy with the money available with you? Try to balance it with your health system. Don't take everything towards COVID vaccine and leave your health system, because you are not doing yourself any good. COVID-19 is just one bit out of various other diseases. And so if you improve your health system, also get vaccines and get support for more vaccines, it makes sense.
Yeah, thank you so much, sir. We're actually wrapping up now, and I'm just checking to see if there are any lingering questions from our live audience. But in the meantime, we just really want to thank you for your time and your expertise. We have been thoroughly educated and informed, and I believe our audience too, and for whoever will be watching this recording after the fact. There's this quote from Solomon Zedru, who is the director for Africa policy at Gates Foundation. He says, what we don't know about Africa and COVID-19 is far less important than what we do know, because the things we do know are amazing and important and have surely contributed to Africa's overall success in weathering this disease. I don't know if you want to expand on that quote, sir.
Yeah, the quote is very true. It's amazing what we know now about COVID vaccine, or COVID itself. Amazing. Most publications now are just driven towards COVID in all sub-disciplines of medicine. And so a lot is coming out from it, and a lot will still come out from it. And so if we even make do with 10% of the knowledge or information available now, it will do us a lot of good. So we shouldn't capitalize on the little that is yet to be known.
Thank you very much, sir. That's really being optimistic. Ashwin, I don't know if there's anything else you want before I do the final wrap up.
Sure. Thank you, Dr. Akande. It's been an incredible opportunity to speak with you today. And we also thank our viewers for listening to, watching this program today. And we hope to bring in more leaders in the coming weeks. And please get the following going, and feel free to reach out to us. We are available. We'll share the links with you right after this video. And thank you once again, Dr. Akande. Over to you, Maimuna.
Thank you
so much. My pleasure.
Yeah, and like Ashwin said, it is a pleasure and an honor to have you, sir. And you inspire a lot of us. You've mentored a lot of us, and our audience. The feedback so far is like this was a very informative session. So for our live audience, again, we thank you for joining us. We hope this has been an enlightening session. Please subscribe to our channel as we create more content, as we seek to highlight more voices on the field in global health issues. And lastly, Professor Akande, if anyone wants to reach you, what is a good contact detail for you?
How? To reach me, I think
on either social media or to collaborate or just learn more? How can they reach you, sir?
well, I physically a professor with the University of Ilorin in central Middle Belt, Nigeria. So that's for physical. If it's for reaching, then I always prefer that it's through my email. I'm on Facebook, I'm on LinkedIn, and my email address is akandetm, akandetm @gmail.com, or better still, akandetm@unilorin.edu.ng.
Thank you very much, sir.
Thank you.
Yeah, that's a wrap on our end. So thank you all once again for joining, and please stay safe and stay well, everyone. Bye.
Bye-bye. Thanks, Nemona.